The most common question I get asked in OPD is, can CKD be reversed? The honest answer is, it depends. It depends on what is the cause of your kidney dysfunction. Now, as you know, the kidney is made up of millions of filtering units called the nephrons. In true CKD, these nephrons undergo permanent damage over a long period of time, usually more than 3 months. This damage is typically caused by high blood pressure over several months or years, high blood sugars, or certain immune-mediated damage going on for several years, and this causes permanent scarring or fibrosis of these nephrons. Now, fibrosed or scarred nephrons cannot be regenerated. No amount of detox diets, herbal supplements, magic cures or praying can reverse this kind of permanently fibrosed nephrons. What remaining nephrons are left, they go into overdrive and they try to compensate and do the work of the damaged cells as well. This is a true CKD. So a true CKD cannot be reversed. But do you have a true CKD? What is important to distinguish is a CKD from an acute kidney injury. An acute kidney injury is a damage of the kidney cells that happens over hours to days or sometimes even weeks. This may happen due to dehydration, certain kind of infections, certain kind of toxic damage to the kidney by drugs, herbal supplements, unregulated toxins, even poisons. It can happen due to immune-mediated conditions known as glomerulonephritis, which cause inflammation in the kidney. It can also happen due to obstruction to the urinary passage. In this condition of acute kidney injury, if we cure the offending cause, we can actually reverse the kidney damage. What you should also be able to distinguish is conditions that look like CKD but may not be. The number one most important is a single abnormal value of creatinine. A single abnormal value of creatinine cannot diagnose you as CKD. A single abnormal value of creatinine can happen because you were dehydrated, you had some drugs recently which were toxic to the kidney, you didn't know about them, you are infected or you are not feeling well, you had a very heavy protein meal last evening. All of these conditions can cause a single abnormal value of creatinine. So please talk to your doctor about it. Number two, if you are using certain medications which can cause a rise in creatinine and you're using them over a period of time. For example, certain people are on painkillers over a long time. People are on certain chemo drugs, certain cardiac drugs, even certain herbal supplements. These are toxic to the kidney, and if you are taking them, your creatinine may rise. But when you stop these drugs, your creatinine may come down to normal. Third is a chronic obstruction. In elderly males, sometimes they have chronic prostate obstruction, or some people may have kidney stones which are blocking their kidneys over a long time. And once these obstructions are relieved surgically, usually the back pressure of the kidney comes down and the creatinine comes down. Also, immune-mediated conditions. These are called as glomerulonephritis. These are usually inflammation of the kidney cells caused by certain autoimmune or immune-mediated damage. They are diagnosed by doing a kidney biopsy. And if your doctor finds a glomerulonephritis, there are certain specific medications available for these conditions which can actually cure the kidney. Also, some people who have a sudden recent rise of blood pressure or sugar, if that is controlled, that may also bring down the creatinine. Another thing to watch out for is an AKI on CKD, which is you have a stable CKD where your creatinine was going stable for a long time, but now suddenly you had an acute kidney injury on top of that because of all the causes that I mentioned, and that can cause a sudden rise in creatinine. This may not necessarily mean that your kidney damage has progressed. It just means you have an acute kidney damage, and once the doctor finds out the cause and treats it, your kidney function may come down to its previous baseline. So, it's very important that you discuss with your nephrologist regarding what is the cause of your rise of creatinine and whether it can come down. But even if you don't, Even if you have a chronic kidney disease in its true sense, there are ways in which, by following lifestyle measures and your doctor's advice, that the remaining kidney function can be preserved. It is said that in patients who don't control their blood pressure or sugar and don't follow lifestyle measures, the chronic kidney disease can progress as fast as up to more than 10% per year. But if you control all the lifestyle measures, control your blood pressure, control your sugars, your doctor gives you medicine to decrease the protein leakage in your kidneys, they put you on certain kidney protective drugs like SGLT2 inhibitors, etc. You protect your kidneys from all the toxic damage that I mentioned, then we can bring down this progress of CKD by as little as 1 to 2% per year. So follow your doctor's advice. Don't get rattled by your creatinine. Don't get depressed thinking about irreversible CKD. There might be hope.